Hello, future FMF warriors. This is H1 FMF and Jason Harris. Once again, we're going to be going over Section 113, which is Chemical, Biological, and Nuclear Defense Fundamentals. All right, first question would be, describe in detail the NATO contamination marker for chemical contamination. Next question. Describe in detail the NATO contamination marker for biological contamination. Next question. Describe in detail the NATO contamination marker for radiological contamination. Next question. Describe in detail the NATO contamination marker for chemical mine contamination. Okay, next question will be, name and describe the different ways to give the CBRN alarms. Next question. Upon receiving a command or detecting a contamination, when donning your M40 gas mask, what is your absolute first step? Again, upon receiving the command or detecting a contamination, when donning your M40 gas mask, what is your absolute first step? Next question. How do you assess that you have achieved an airtight seal when donning your M40 gas mask? Okay, next question. When do you adjust the temple and forehead straps of your M40 gas mask to ensure proper fit? Okay, next question. Your M40 gas mask must be donned, cleared, and sealed within what amount of time? Next question. What does the acronym MOPP stand for? In other words, what does the acronym MOP stand for? Next question. How many total levels of MOP are there? Okay, moving on. When a sailor or Marine carries his or her protective mask, what MOP level is in effect? Okay, next question. What is MOP level 0? Okay, next question is, what are the advantages and disadvantages to using M8 or M9 detector paper over the M256A1 kit? Once again, what are the advantages and disadvantages to using the M8 or M9 detector paper over the M256A1 kit? Okay, next question. How many levels of decontamination are there? Next question. What are the levels of decontamination? Or name the levels of decontamination. Next question. What are the 3 techniques of immediate decontamination? Next question. What are the 2 techniques of operational decon? Next question. What are the 3 techniques of thorough decon? Next question. Skin decontamination should be conducted within what amount of time? I repeat. Skin decontamination should be conducted within what amount of time? All right, moving along. How do nerve agents produce their effect on the body? Next question. In general, what are the physical characteristics of a nerve agent? Next question. What are the signs and symptoms of being exposed to a nerve agent? Next question. What is the treatment for nerve agent exposure and how is it administered? Next question. If you encounter a service member suffering from severe signs of nerve agent exposure, how do you treat that casualty? I repeat. If you encounter a service member suffering from severe signs of nerve agent exposure, how do you treat that casualty? Next question. What are the common blister agents? Or name the common blister agents. Next question. What is another name for blister agents? Next question. What is the most vulnerable part of the body to mustard gas? Next question. What is the primary cause of death due to exposure to mustard gas? Next question. How do blood agents produce their effect on the body? Next question. What are the signs and symptoms of exposure to a blood agent? Next question. What kind of odor does a blood agent have? Next question. What is the immediate treatment for a blood agent exposure? Next question. After initial life-saving treatment, what is the required therapy for blood agent exposure? Okay, next question. What is the most common choking agent? Next question. What type of odor does the most common choking agent have? Next question. What is the treatment for exposure to a choking agent? Next question. What are incapacitating agents? Next question. What are the signs and symptoms of incapacitating agent exposure? Next question. What is the treatment for exposure to an incapacitating agent? Next question. What are the different classes of riot control / harassing agents? I say again. What are the different classes of riot control / harassing agents? Next question. What is the treatment for exposure to a riot control / harassing agent? Okay, next. What is white phosphorus? And my last question is, how do you treat white phosphorus particle embedded in the skin? Okay, FMF warriors, that will conclude my Section 113 Chemical, Biological, and Nuclear Defense Fundamental questions. Just keep in mind that these questions are not only important for obtaining our FMF warfare pin, but also for advancement exams. Thank you.